and welcome to the second session of Health Live at Seniors Today. Since we launched in July last year, we've received a stupendous response. Given that it concerns senior citizens, health has always been an important component of our magazine and website. In fact, we were among the first media destinations in India to carry informative and, more importantly, authentic content on Covid-19. I'm Pradyuman Maheshwari, and I have the great pleasure in inviting Dr. Aditya Agrawal, who will speak with us today on how to take care of oneself as the lockdown eases and there's greater movement in our cities and towns. Readers of Seniors Today would recall that Dr. Agrawal had written for the magazine in December last year. We are delighted to have you here with us, Doc. Welcome to Health Live at Seniors Today.
Thank you, Mr. Maheshwari. It's a pleasure to come back to Seniors Today, and I was very, very happy to write the article on cough, which I did in December. I hope it was well received by the...
It was very well received, and when are you going to be writing next?
You invite me for another topic, health related, and I'll come back.
Great. And how's been the weather in and how's the COVID-19 situation? You are a leading pulmonologist in the city, and obviously up close with what is happening.
We are in the midst of a pandemic, and ever since it all started in the month of March, and even before that, for chest physicians like me who were seeing undiagnosed viral pneumonias in the months of January, February, and March, before the whole world got to know about the COVID pandemic, or at least in our part of the country, we have had a constant stream of patients coming in with very severe disease, or also a lot of patients with no symptoms or mild symptoms. So the disease is covering a wide range of severity. Yes.
Right. So I'm going to invite you to speak for a few minutes on the situation. As the lockdown eases, what are the special precautions that you would like people to take for themselves and for their families and for senior citizens in particular? From your experience of the various cases that you've handled, of people who come with all types of complaints, all types of fears. So your opening remarks, if we can have.
Our senior citizens should be extremely careful about this infection, and they should stay indoors as far as possible. And while they are doing that, they also need to understand that as age advances, each human being develops several other diseases, comorbidities as we commonly call, such as high blood pressure, diabetes, heart diseases, etc. It may not necessarily be very high, but even any kind of uncontrolled hypertension, that's blood pressure, or diabetes, which could be even borderline, increases your chances of getting a very severe disease. Under most circumstances, most people would have a very mild or asymptomatic disease wherein the patient gets the infection, but it does not really harm him as much. But when the disease does get severe, a patient starts experiencing fevers which do not come down with paracetamol. They start getting breathless, they start coughing, they start developing a pneumonia in their lungs. And in the extremes of cases, we get things such as we may have a myocarditis, which is a heart condition in which the virus causes short circuiting of the heart. It can also cause strokes. It can cause several other neurological problems. A lot of patients come down with diarrhea or diarrheal diseases when they have COVID infection. So COVID basically causes a wide range of symptoms, which is not specifically only related to a lung, but it can range from the brain to the heart to the muscle. So now what do we do? Now the most common to understand how you can protect yourself is to first understand how does the disease spread. And over the past 3 months, a lot has been said about how you can protect yourself by locking yourself in the home, bathing in sanitizer, or washing your hands every moment, and being away from other people, which is partly correct, but not entirely. Now, what we need to understand is we should limit our contact with unknown or unverified sources completely. If we are coming in contact with something which we don't know about, we need to wash our hands with copious amounts of soap and water. At least 20 seconds of hand washing with soap and water does the job. Sanitizers, yes. So when you do not have access to soap and water, sanitize your hand with at least a 70% alcohol-based hand rub. Then what else do we do? We need to avoid people who we do not know, or we need to avoid people who have the infection or who appear ill. So no, social gatherings are a strict no-no. Even now, we may be easing our lockdowns, but then that does not mean that you need to, you know, sorry, we need to make sure that we are not stopping, or rather we are not stopping our social distancing. The minute you start socializing, the lockdown is actually to restart the economy. It does not mean it is going back to socializing. Yes, Mr. Maheshwari?
Yeah. So, my question to you, and I'm going to read out a question that Roxanne Pambot has sent, that once the lockdown eases, there's still a chance of catching the virus. And, you said anything else that you would recommend apart from keeping a social, physical distance with others? Uh, you know, how can a senior citizen protect himself or herself while going about their daily life? And one of the things is that today in a city like Mumbai and Delhi, you have senior citizens who are going out for work and who are 65 plus. Uh, would you say that they should not be stepping out of their homes at all?
Not at all. I did not mean to say that. So senior citizens can step out of the home, get out of the home, get into their car, get into their office. But at the same time, minimize meeting other people in person if you don't need to meet. Avoid crowded elevators, avoid crowded restaurants, avoid meeting friends in the park. If you do have to go for exercise, do go. You still need to get your exercise with your walks, with your jog, etc. But that does not mean that you meet a group of people and socialize with them, because you never know who may be infected amongst you, or even amongst your friends, and they may be asymptomatic carriers of the disease. The other thing is, when you are going into an unfamiliar environment with areas where you do not know who has an infection, what happens is you may invariably touch a surface which carries the coronavirus germs, which you can pick up on your hands or your clothes, which, if again allowed to enter your body in the form of rubbing your eye or your nose or your mouth, you may contract the infection. So ideally avoid social gatherings, avoid meeting too many people, meet a few people who you trust.
So senior citizens, people who are 65 and above, they can go to work. We have Dr. Kishore Chandra Ganatra who's asked a question. What about senior citizen doctors in their 70s with comorbidities? Should they go back to their practice in July after being at home for almost 3 months? Or forget about it? For how long, he asks?
Dr. Ganatra, if we go back and look at how the Italians were working, even the senior Italian doctors as old as 80-year-old were going back to work, and they have actually beaten the virus. They have actually gone back to work and not have we. Can you hear me?
Yeah, we can hear you. We can hear you now.
Yeah. So what is important is that you take adequate precautions. So if you are seeing patients, you need to make sure you're not seeing too many at one go. When you are seeing patients, you should have adequate protection in the form of a hazmat suit, N95 mask, a face shield, double gloves, lots of sanitizer around you. You should make sure that the patient entering your clinic is wearing a mask. He sanitizes his hands before he walks in, and he is well covered at a distance of at least 3 feet while you're talking to him or taking or doing a medical interview. The next thing is, while you're examining a patient, avoid examining the nose and ear and the throat. If you do have to, make sure the face shield is on. The other thing is, while auscultating, that is when checking the breath sound or checking the lung, make sure you're only listening to the breath sounds over the back. Do not come up in the front and listen to the breath sounds of a person, because what that does is it brings you in direct contact with the exhaled breath of a patient. And to make you understand a little more, it is actually the breath, the droplets which come out of the respiratory system, which are the source of the coronavirus now. So doctors are supposed to get back to work. Now, the only thing is, when you are an elderly consulting doctor, you need to make sure you need to weigh your pros and cons. The biggest thing is, if you have comorbidities, if you have things like blood pressure, diabetes, heart disease, make sure that they are in control. Keep yourself healthy. If you think you do not, if you have these medical conditions and they aren't in control, avoid going back to your practice, sir.
And we have Seema Gupta, who said, if we call part-time maids, how do you take care when they're at work?
You know, in India, health is actually a luxury which we have taken for granted for too long. We need to start doing our own jobs now. We need to start taking care of our own homes. Yes, having a maid over is fine, but not in the current scenario. Now, every human being is a potential carrier of the coronavirus, and you don't know what kind of social distancing the other person can maintain. So for me, even my neighbor or a friend would be, I would like to social distance myself from them. Like, I haven't met my friends in a long, long time now. And the reason why I'm doing that is because it may be me, it may be them. One of us can transmit the infection to the other. I'd rather see them when the things are better, in a healthier state, than have somebody come near me. Now, mates, if you can ensure that they are going to be very careful, if you think you can uh, take care, you can ensure that they take care of themselves, then yes, definitely you can call them back. And these part-time mates, obviously they keep moving from home to home, and you don't know in which home there is an infected person. So I would suggest do not have them.
And Sanjay Hegde asked, is it correct that this virus does not spread through air, and or has it mutated now?
Oh, it doesn't spread through air. It actually spreads with a droplet infection. So when somebody sneezes or coughs, his respiratory particles go and settle on the surfaces around him. It could be the wall, it could be the floor, it could be the table surface, it could be anything. It could be a sofa for that matter. And if another, or even if you're standing near an elevator and if somebody coughs, his viral particles may go and stick to the door of the elevator, or it may go and stick to the button of the elevator, and that's when somebody else who touches it can get the infection. So there's no mutation for this thing of the virus yet.
We have Shobna Vora, who asks, does the intensity of virus reduce when it passes from A to B, B to C?
Now, that's a tricky question. That's a good one. No, there's no way that it reduces in how severe the infection is. But yes, what we have seen is healthcare professionals, that is doctors and nurses, especially those who are the frontline doctors like family physicians, emergency medicine physicians, are actually bearing the brunt of the disease because they see so many patients and they get so much virus from so many different sources that the total amount of viral loads that they have is far higher, and hence a more severe disease.
Right. Kamal Pradhan asks, can I keep my mom's helper? His mom is paralytic.
You could actually do that, but then what you need to understand is the person who's caring for your mom should be extremely careful, and you should be able to impart the same kind of hygiene and levels of maintaining personal hygiene as you do for yourself. If your helper can do the same thing and maintain social distancing, then yes, you can keep the person to care for your elderly mom.
Daljit Madan asks, he's 80 years old and I have COPD for last 20 years. Have kept myself indoors so far. I have oxygen concentrate at home. Will it help if I take it daily for about half hour?
So now this is a very specific question, sir. If you have COPD, make sure that your COPD is well controlled. Have you had several exacerbations or several attacks of COPD in the last 1 year? If yes, make sure you're indoor. If you haven't had, make sure you're continuing a good level of control of your COPD. Exercise regularly. You need to take your inhalers every single day without missing them. Maintaining your COPD is extremely important, and taking oxygen unless you have respiratory failure does not help you. Uh, a patient with COPD should not take oxygen unless he's been advised by a doctor, because then it can be counterproductive. People who have been smoking all their lives, or people who have been exposed to large quantities of smoke, have a certain condition called chronic bronchitis or COPD, which makes your oxygen levels drop. But if you take too much oxygen, or if you take oxygen without a prescription, you run the risk of making your breathing stop. Your body stops functioning, and that will harm you more than do good.
We have another question from Daljit Madan. And it's an interesting question. He's asked a few more questions, but I want to ask this one. If you're with a mask and taking a walk and you cross a corona positive next to you and he or she does not cough or sneeze, can you still get infection from
No,
the...
not at all. Not at all. Do not treat them as pariah. They are not. Now, if somebody who has COVID infection and he's walking past you, he's not shedding the virus except when he coughs or in his secretions. So he's not transferring saliva, or his sweat, or he's not sneezing or coughing over you. So he's not going to transmit the infection to you. You're not touching. So there were certain reports initially that stool or that the potty of a person who has COVID infection can potentially transmit infection, but that's not proven even now.
There's a question from Zareen Malwa who says, these are of course available at most shops, and now that the shopping e-commerce sites are up and about, one can order from there. But please tell us where we can get masks and shields, and perhaps the masks that are good and shields that are genuine and of good quality. Where do you source them? Is there any specific thing that one must look at?
Sir, I don't think you should be worried about masks and shields unless your job profile requires you to meet several people each day. So a very simple two-ply surgical mask is sufficient for an average person. A better mask, or the more protective mask, such as the N95 mask or the N99 mask, are specifically to be used by healthcare workers, that is nurses or doctors, who are seeing several people with the COVID infection. Now, what you need to make sure that you have a mask which is made of at least two to three layers of cloth, and that should suffice. If not, you can go walk into your regular medical shop and buy a two-ply surgical mask. These used to cost about ₹1 each before the lockdown, and now it's at about 10 rupees each. They're cheap, effective, disposable. Do not use one for more than a day. You may wear the best mask in the world, but what happens is you should know how to handle your mask. That's also extremely important. So just the most expensive mask that will ensure you the best quality of protection is actually a wrong notion. You should make sure that once you wear a mask, you do not touch the front surface of a mask. If you are handling a mask after you have worn it once or been in public with it, you handle it with the strings or the ribbon around it, so that you do not come in contact with the surface which can pick up the virus. The other thing that's important is you should understand is the virus which we were talking about does not penetrate the cloth. What it does is it gets repelled by the surface electrical charges on the mask surface, and hence it prevents it. Rather, the mask is preventing you from getting the infection. The other thing is, when you wear a mask, you're actually preventing infection to other people. So if a patient who has the COVID infection and he wears a mask, he's not going to potentially transmit the infection to anybody else. But suppose if he's not wearing a mask, but you are wearing a mask, the risk of you contracting the infection still remains very high.
We have a question from Rajesh.
Does that answer? Was it helpful?
Yeah, I think it was. We have a question from Rajesh and Aditi. Is it safe to use cabs? Is it the various Ubers and Olas, is it okay to use them? What kind of precautions should you take? Should you have to change your clothes the moment you leave the cab? Is there some special disinfectant that one must use? These are some of the questions that, this is a question that he asked, and these are some add-ons from me, because I use them too.
If you were asking me for my personal opinion, I wouldn't have used public transport. I would not use a shared cab with anybody else. I would rather stick to my own car or walk it up to wherever I need to, or avoid unnecessary travel. A cab. So if the previous passenger was coughing, had the infection, and has probably left behind some droplets of the virus on the surface of a cab, you may pick up the infection. Now, as far as disinfecting is concerned, the onus of disinfecting the cab lies with the taxi driver. Now, I cannot trust somebody else to disinfect the surface of every single surface of the inside of a cab. It would involve so many surfaces. It would involve the seats, the seat in front of the passenger. It would involve the doors, the knobs, several things. That's not possible. It's not practical. So invariably, you're going to infect yourself.
So are you saying an Uber and Ola is an absolute, or the Kali Pili is an absolute no-no?
I'm not giving you any absolutes here, but I'm giving you my personal opinion here that I would not use one.
Okay. We have a question from an anonymous attendee who says, should we allow our clothes to be washed by dhobis? Is there any possibility of COVID being transferred to the clothes cleaned? What would be your recommendation? And just as the washing is concerned, what about giving your clothes to the dhobi for ironing?
You could actually give your clothes for laundry, for ironing, but then make sure that once they are back, you do not use it for the next 2 to 3 days at least. Allow them to lie on the shelf for 2 to 3 days and then use them.
But when you're keeping it on the shelf, it's, you're stacking the clothes one above the other, right? So it's not being allowed to be aired as such.
That's okay. That's okay. So it is known that the virus does not survive beyond 72 hours on any surface. So it is less likely that you're going to get the infection or you have the viral transmission with the formite or with the surface after 3 days.
There's a question from Fariz Pavri. She says, I'm a caretaker of a senior citizen and need to go for blood test to a clinic. Is there a risk for me to get infected and potentially risk the senior citizen?
So if you are going into a clinic, yes, definitely. Most clinics and doctors now take adequate precautions between patients. We space out our appointments to an extent that we do not have two patients meeting each other in the clinic at the same time. Second thing is we usually have sufficient time gap between the two patients. So we get time to clean the surfaces which a patient may have touched, which would involve the waiting area, the sitting area inside the consulting room, then the tables where the patient has been examined, the personal equipment used by the doctor, such as the face shield. We are sanitizing the tables, the stethoscope, and we are obviously wearing a face shield while examining the patient. So the patient is also reassured that he's not going to get the infection from a doctor, should the doctor be infected.
But this is, of course, at a diagnostic lab, you don't really interact with the doctor, but it's possibly a lab.
So when I speak about a doctor, I mean to reproduce the same kind of experience with a laboratory where you go in, where you have other healthcare professions such as a phlebotomist who's drawing blood, or an X-ray technician where you're getting an X-ray. Most people are now maintaining adequate levels of hygiene. If not, avoid the lab.
We have Kavita Ghatke who says, I'm a senior citizen marathon runner and I'm happy that we'll be able to run once again and train in the open. But find it that it's impossible to run with a mask, which is mandatory. What's your guidance?
I'll just explain how this works. Okay, when you're not wearing a mask, you're breathing in air which has 21% oxygen, and you exhale air which contains 16% oxygen. So you've consumed about 4 to 5% of the oxygen out of the air which you're breathing in. Now, when you wear a mask, you're actually enclosing the air within the surface or the inside of the mask. So when you breathe with a mask on, you're breathing in air which contains only 16% oxygen. So your body is deprived of oxygen or adequate concentration of oxygen when you are breathing through a mask. When you are exercising, you are consuming large quantities of oxygen and you're exhaling out large quantities or larger quantities of carbon dioxide. So when you wear a mask for long periods of time without exercising also, you feel drowsy, you feel sleepy, and you feel flushed. You feel that, you feel warm and irritable, and it takes a toll on your health. So when you wear a mask and run or exercise, what you're doing is you're rapidly breathing that same air with a lesser amount of oxygen, and that can cause respiratory failure. It can dangerously increase the amount of carbon dioxide in your body and can be detrimental to your health.
We have a question from Daljit Madan again, and although there are several questions waiting, but it's an interesting question. Is it correct that your hair catches the infection fast?
The hair catches infection fast?
Earlier, yeah.
Now, okay, thank you. You've just stumped me actually. This is the first actually. Any surface. So if any part of your body, if it comes in contact with the virus will stay on there. Okay. So if you are actually asking me this question with regards to the beard or with regards to a mustache, especially I believe, sir, you are a elderly sick gentleman, and you have heard of several case reports, or rather several stories of doctors from the UK and Canada who have had to shave off their beards to wear masks. Yes, definitely. The reason why those doctors shaved off their beard, which they had kept for religious reasons, is because when you're wearing a mask, or N95 mask, it should fit very closely to your skin with no gaps. When you have a beard, what it does is it creates a gap between the surface of your skin and the mask, allowing a gap for the virus to go in or to be breathed in.
Doctor, do I need to worry about my mustache?
So when you wear a mask, a mustache is fine because it does not come in contact. Your mask will not oppose your mustache. It would have opposed your beard, your chin, the bridge of your nose, your cheeks. That's what you should be worried about.
There's a question from Sunil Jain. Is it risky to order in food from restaurants? Can COVID spread via food?
So there are no case reports. So if I give you scientific literature out here, there's no scientific evidence of transmission of coronavirus through food. But what is important is it's the humans who are the dangerous elements here. People who handle food, and if they have the infection, and if they transmit or droplets upon the surfaces, on the vessels, upon the containers of food, yes, you may get the infection.
Then the number of questions that have come in, Doc, we could be, spending time till tomorrow morning with the number of questions that have come in.
I would love to answer them, and maybe I'll shorten my answers a little bit so that more questions can be taken in.
Okay, and these are questions which are beyond your specialization, but these are questions which are there. What is the best way to sanitize vegetables and fruits delivered to us at home?
So when you do get vegetables and fruits at home, make sure you ensure that they are washed very well under water. I've heard of people using salt in the water and using baby detergents or food safe detergents, which should be a good option. The other option is you could just leave the fruits and vegetables away for about a day before you touch them again. And that should be enough to sanitize the fruits and vegetables.
Surekha Bafna asks a pertinent question. How safe is a person once recovered? For how long will he or she not be affected again?
Okay, that's a good question. So most people now we understand is that after day 10 of the start of symptoms, or if they have had no fever for at least 3 to 5 days, do not transmit the infection actively. However, we still keep a gap of about 14 days after the onset, after the stoppage of all symptoms such as fever and breathlessness. So, and we give this period of time for the patient to recover and stop transmitting the virus. There have been case reports from Japan where we have seen reinfection. But closer home, I can tell you that we have had a hospital staff member who came down with the coronavirus infection in April and has now come back again last week with the COVID infection. Now, what could be the potential reason for his infection? One, the probably because of his low immunity, his blood pressure and diabetes prevented his infection from getting cured completely, or it could be that he picked up a fresh infection from the society. We never know.
There's a question by Upan Doshi, and it's about homeopathy. Can any medicine of homeopathy or any pathy protect by increasing immunity? A lot of messages are being circulated about Arclin 30, the homeopathic drug. Is it safe to take it? What is your advice about, any pathy medicines?
I'm an allopathic specialist. I have very little idea, or I'm completely ignorant about the other systems of medicine such as Ayurveda and homeopathy. But let me assure you, the only way to keep your immunity high is by maintaining good health. Make sure you are exercising, you're eating right, you are taking your medicines for other diseases such as blood pressure, diabetes, heart diseases, or whatever it could be, and not allowing yourself to be immunosuppressed, or you do not allow your immunity to go down because of other diseases. The other thing is stress. Stress is also a very important factor in maintaining your immunity. The minute you're stressed, your immunity levels go down and you may have a very severe infection.
Right. We have a question from Daraya Sirani. Is it okay to get a couple of bad teeth extracted by a dentist and for further treatment?
A dentist would be extremely scared to take you into his clinic at this point of time. But if you have to obviously get rid of your teeth, you have to get them removed, right? So you have to be extremely careful and make sure you are COVID negative before you turn up at a dentist clinic. And just this afternoon, the Ministry of Health has given out instructions to the ENT specialists that do not do any surgery unless it's an absolute emergency.
Which is something which they had even issued right at the beginning, right? Where all non-essential surgeries can wait.
Yes. No, but you know what? We are now, since the lockdown is now easing, a lot of us have gone back to starting off the non-essential, non-emergency surgeries, and which I think is fair enough. We can't live with the constant fear of COVID infection, but we need to make sure that we take adequate precautions or take adequate safety measures, both for the patient and the doctor, and obviously the healthcare professions such as the nurses, the other staff members.
We have a question from Sarajit saying, my children are starting work. What precautions do we need to take once they return home?
So once they return home, make sure that what they do at work is also important. You need to make sure that they keep themselves sanitized at all times. You make sure that they do not socialize with too many people. When they come home, make sure they're going for a bath immediately. Washing hands is extremely important. Make sure you have a bottle of hand sanitizer at your door, wherein they rub alcohol into their hand before even ringing the bell, which is the thing which I do. I usually, before touching the lift door or the elevator button, I usually sanitize my hand. And when I get off the elevator, I usually sanitize my hand again. So what that does, if I have invariably touched the surface in the elevator, I have disinfected myself before doing that.
We have a few questions from Chabi Mathur. Chabi Mathur asks, is there no hope if an asthmatic person gets infected?
Oh, you know what? this is my favorite question of the day. We are seeing that a lot of our asthmatic patients are doing extremely well, extremely well. I think it's the inhaled medicines which are helping our patients with asthma. In the last 3 months, I've had not a single asthmatic patient of mine, which would run into thousands right now, who have come down to the COVID infection. And another interesting thing that's happening is me and my mentor are working on an inhaler with the South Korean researchers with an inhaled drug which is preventing or treating the COVID infection rather quickly. We have had the opportunity to give about 150 patients these inhalers, and our patients are doing extremely well. Their cure rates are very high, and their disease is getting cured much faster than the people who have not been given the inhaler. So this is early days. I'm not promising you anything right now, but we are in the process of writing the paper, and once we have foolproof data to present to the world, we will do so for the benefit of humanity.
Are these inhalers available anywhere? In fact, there are some people who've written in that they want to consult you. I obviously don't want to give out your phone number and email address, but is there some connect that they can make?
So they can always connect me at my Opera House clinic. The phone number is 23664455, 23664455, or they could email me, or they could even message me on my phone. It would be difficult to answer individual phone calls. So at this point of time, I answer about 400 to 500 calls a day.
Wow. Now, Charu Patel asks, do we have to take vitamin C and other multivitamin tablets as many recommend these days? She says, Charu says, I have COPD and aged 72 years.
I would suggest that you do take your multivitamins, keep yourself healthy, make sure your COPD is well in control. Vitamin C, yes, you could take supplements, but if you are living your normal Indian life wherein you eat a very balanced diet, which involves roti, sabji, dal, chawal, vegetables, which involves salads and a fruit, then I'm sure your diet contains sufficient supplements which do not need to be given in the form of a capsule.
There's on cleaning of food, vegetables. Zareen Malwa asks, is potassium permanganate good for fruits and vegetables to be sanitized? Potassium permanganate, baking soda, whatever else.
I would suggest do not use potassium permanganate for doing that. High levels of potassium can actually kill you. So you're actually using poison to sanitize your fruits and vegetables. Don't do that.
Okay, I have a whole lot of other questions. Which my son is coming back from ship by airline. What precautions should be taken when he's in home quarantine, and what also tests should be done for him?
So when he's coming back from a ship on an airline, he would be quarantined for at least a period of 14 days. And when he comes back, he'll be watched for symptoms. If he exhibits any signs of a COVID infection, he would be tested with a nasal swab for the infection. So you're not going to see him after he lands into the city for at least 14 days. Otherwise, you wouldn't have, after the 14-day period, you wouldn't have to do anything unless he's infected.
Ganesh Jairamans asks, I'm 72 and have hypertension under control with medication, and I've also had a bypass heart surgery. Do I need to use an oximeter for knowing my oxygen level in blood? And another question which somebody else asked me was, are oximeters, just having an oximeter at home, is it a wise thing to buy?
I don't think we need to build up so much panic and fear amongst ourselves such that everybody buys an oximeter. I was buying oximeters for 1,000 rupees till a few weeks ago, and now because everybody knows about the oximeter, everybody's buying one, and the price has doubled and tripled right now. You end up buying oximeters for 3,000 and 4,000 rupees, which is of no use. Oximeter should be used only and only by a doctor, or if you have a pre-existing lung condition which makes your oxygen levels drop, then use an oximeter. Now, what is important is to understand is that when you have breathlessness, you already have a moderately severe disease. A asymptomatic or a pre-symptomatic or a mildly diseased person would not exhibit signs of breathlessness. So in the early stages of disease, you would have fever, cough, headaches, weakness, muscle pain, diarrhea, or any of the other symptoms. And that is, what you should be very careful about. If you have any of these complaints, immediately seek medical help. Do not wait for it to progress to breathlessness. Because when you have breathlessness, it means a part of your lung has a COVID pneumonia, or you are having a serious effect of the infection on your heart, and anybody who is breathless should be admitted to a hospital. Mind you, at this point of time, the number of COVID beds is extremely in short supply, not because we don't have the beds in the city, it's because we don't have enough manpower to help us run these beds or run these clinics. For every one doctor, we need a support staff of at least 7 to 10 people. And at this point of time, because of the fear, a lot of nursing staff, a lot of class 3, class 4 workers who are our back-end support are not showing up to work. So a doctor can do only so much. So do not get infected. Prevent yourself from getting the infection by taking adequate precautions. Stay indoors. If you do need to go outdoors, make sure you're not coming in contact with other human beings in close proximity. Be wary of surfaces. Be wary of contracting the infection from unknown surfaces.
You have kind of answered this question, but our Mehta's asked any special precautions for asthma sufferers.
Anybody who is asthmatic should understand that they should be taking their inhalers regularly as recommended by their doctor. Anybody who is coughing or having breathlessness or is having wheezing or has had a sleepless night, has had difficulty doing their job or has difficulty in performing their exercise should consult a doctor for the asthma immediately without the asthma worsening. Anybody with a bad asthma control may get a very severe infection of the COVID.
CYC says, ask in view of COVID-19 and if our domestic help is coming from faraway areas in, like Govandi through trains, how do we take precautions if they have to come into our homes once the train restrictions are lifted?
So now for the next 6 months, I'll be extremely careful when I'm hiring help. I would hire help only if I'm extremely sure of how they are traveling, who they are traveling with, and if they are working in controlled environments. So once the trains start, once the lockdown ends, local trains can become extremely important or a big source of spread of infection. I wouldn't hire such a help who's coming from a faraway place in public transport for the fear of infection.
Renu Vaswani has asked a very pertinent question. What is to be done if no bed is available in a hospital?
Okay. And now I do understand that, there's been a shortage of beds, and I personally have lost a lot of patients in ambulances while they were hunting for beds, or I have lost patients only 3 days ago for want of a bed, though I go to the biggest hospitals in South Bombay, such as Bombay Hospital, Bhatia, Wokat, Pasi General, and even then we didn't have a bed for such patients. Remember, the first symptom is a sign that you get tested. If you have any of the symptoms and you get yourself tested, what it does is it gives you a safety net. The safety net is that if you are COVID positive, the chances of getting a bed is extremely high. But if you have not had a test for COVID done, or if your test is negative, then we do not have suspect beds or beds where patients who are suspected to have the coronavirus infection can be admitted. Because you wouldn't want, or doctor wouldn't want somebody who's who does not have the corona infection going into a space where there are patients with a COVID infection.
Pankaj Mehta asks a question: is there in the inhaler that you have that you are preparing with the partners?
It's not for the common person to have it right now. Once we have literature, so it's going to be like how everybody is using the N95 mask. I'll see everybody is stocking up the inhalers with themselves right now, or everybody goes back and buys hydroxychloroquine or the malaria medicines like it happened 2 months ago. So if it has to be used, we will use it for you. Do not worry about it.
One question from Pratik Jadhav: can senior citizens who have diabetes take vitamin C tablets to increase immunity? If yes, then please suggest the tablet name.
The best source of vitamin C is fruits. And if you think you can take those fruits and your diabetes is well under control, continue having fruits. But if you do not like fruits and you want to still take the vitamin C, then the next best option is something called tablet Limcy or Celine. And you get them in a dose of 500 milligrams, which you need to consume once a day.
There are quite a few other questions. Sanjay Hegde says, how long does the virus remain alive when it comes into contact with any surface? That has been answered. How do you sanitize the car if it is driven by a chauffeur? You've answered a question for
cabs.
If you have a driver, how do you ensure the car is in order?
I would still stick to the same argument. If you have another human being using your personal space, you have to be extremely confident that the other person does not carry the virus. If you can ensure that he maintains the same level of hygiene which you do, then please go ahead and use a car with a chauffeur. But if you have any doubts, then self-drive your
car. How safe is it to take a toddler for vaccinations, especially if it is pending for a long while?
It's extremely safe to do that. So I know about the pediatrician I go to for my child. He's next door to my clinic at Opera House, and he ensures adequate spacing of appointments. There is nobody in this clinic when a patient arrives at the doorstep. The surfaces are sanitized between patients. The staff is wearing face shields, masks, gloves. They are wearing gowns. The inside of the doctor's clinic is also extremely hygienic. So yes, it's extremely safe and it's actually very protective for the child.
Kavita Ghatke asks, what is the risk of handling stray animals for feeding and interacting when they're on the road?
So what's happening is, we are Indians, and you know how Indians spit everywhere. Suppose a patient with the coronavirus infection spits on the road and your pet walks over it, he may bring home the infection. Now, there have been reports of cats getting infected in New York. So now we don't know whether infection from the pets or the virus from the pets can be transmitted to a human being, which is yet to be understood.
Okay. Daljit Madan asks, if the packing of any grocery item is sanitized by alcohol sanitizer, how long should this be kept aside before using?
Sanitizing the groceries with alcohol rub, it could, if the plastic surface is sanitized well, then it could be as little as 5 to 10 minutes. But if you are putting alcohol on food items such as vegetables or fruits, I would suggest you stop doing that. You're going to cause more damage. You're going to be harming yourself.
If you've seen a patient with fever and have not examined him, and a few days later he turns COVID positive, and contact with him was less than 5 minutes, does the healthcare worker have a chance to contract the infection?
Less likely that the healthcare worker will contract the infection in such a case. What is important to note is that the patient who came in was wearing his mask. He had sanitized his hand before he walked into the clinic. He spent as little time in the presence of the healthcare worker, and if the healthcare worker took adequate precautions for himself, like sanitizing his hands, washing his hands with soap and water, that should do the trick. That will prevent the infection.
Sunil Maru asks again, I did not understand your answer. What to do if COVID-19 patient does not get a bed in hospital?
Most patients do get beds in the hospital. If you do not get a bed in a private hospital, you could always go back to a government hospital. Government hospitals are extremely large. They do have sufficient beds, but they also face the same challenges which private hospitals face: lack of manpower, which is not necessarily doctors, but nurses and paramedical staff. So in case you don't get a bed, head out to the closest government hospital. They would try and help you in the best way possible. Or else, if you could use the helpline which is made by the government of Maharashtra, it's 1916, and you could call them, and they have been very helpful a lot of times in the last 2 months for my patients.
Noreen Madani asks, can Dettol water be used as a substitute for sanitizer?
Not really. So dilution of the Dettol is also extremely important. If your Dettol is not sufficiently diluted, it can cause toxicity, it can cause more harm to you, and if it is less than the adequate concentration, it will not sanitize your surfaces.
Okay. Arshia Sheikh asks, is it safe for lactating for COVID mother positive to feed a baby?
We have never, or rather not heard of a direct transmission of the virus via breast milk yet. So I'd assume that it is safe for a lactating mother to feed the child.
CYC asks, would it be sufficient to keep aside all packages which are non-perishables received from outside, from the e-commerce sites for around 2-3 days before using the same? Will it then do away with the requirement of having to sanitize the parcel?
Yes, definitely. I think that's a very sane advice. Follow it.
And somebody asks, what about newspapers? Papers, does the virus transmit through, does it stay on there? Because the government has allowed for the door distribution from June 7th in Maharashtra.
So, Mr. Maheshwari, one thing is that there is no proven scientific literature or data which suggests that surfaces such as newspapers or magazines will transmit the infection. It's still early days, and it is only going to be with experience that we will understand if newspapers will transmit infection. As of now, you could go back to reading your newspaper, but be careful.
So what does one do? If one gets the newspapers in front of you, they're delivered, so you hold them with gloves, or how do you sanitize it? What do you do?
I wouldn't read a newspaper at this point of time. I rely upon electronic media or electronic gadgets to do all my news reading, or in fact, all my reading right now, because we never know who's handled the surfaces or who's handled the newspaper. I would rather be safe at this point of time.
Which is why Seniors Today, the magazine has been an e-magazine since we started.
So another thing that happens is when you have digital print, viewership, your readership increases many-fold, and there is no barrier, a physical barrier, which print media involves. All you need is an internet connection and a device to access the data or your magazine.
Absolutely, and we've seen it. We've seen our readership grow considerably, leapfrog virtually since we launched in July last year. Noreen Madhani asks, are humidifiers helpful?
Humidifiers?
Yeah.
Humidifiers serve no function in prevention of the COVID infection. We use humidifiers in cold places of in air-conditioned rooms where the air is dry. We live in Bombay, and our humidity today is touching approximately 90%. Earlier in the day when it was raining, the humidity was 100%. There is no role of a humidifier in our city.
We could just go on and on. We've done around an hour of the Q&A already. Doc, there are quite a few questions which are coming in. I'm going to ask you, a question from Tulika. My son is 6 years old. Is it okay to take him out for play to a society ground, or now parks are going to be opening up? Is it safe to take the kid out?
Yes, it is safe to take the kid out. Ensure that he's not playing with too many friends or no more than one friend at a time. If he is doing his own activities like running, jogging, playing with his own toy, that's going to be even better. Group activities where people come together to play is something you should avoid. So if I just extrapolate that to adults, when you go to a park, you walk by yourself. You maintain a social distancing of 6 feet. When you are walking in the garden, walk at a distance of 6 feet away from the other human being. And the same thing would be applicable to a child who's playing at home, in his society, or in the garden.
Geeta Agrawal asks an interesting question. How does an asymptomatic patient know that she or he is suffering with this with COVID-19?
A symptomatic person should only be careful about himself when he knows he's been exposed to a person who's COVID positive. But if suppose somebody is asymptomatic, he's never ever going to know that he has the infection. So he rather live with the virus, and the virus will take care of, and the human body will take care of the virus.
Right. And Charu Patel asks how should medicines be disinfected if we order online?
How do medicines get disinfected?
Yeah.
Okay, so usually the medicines which come to you when ordered online come to you packed in a outer casing, in a cardboard box, or in a plastic wrap. What you could do is you could just keep the wrap and sanitize with a little bit of alcohol rub, but do not sanitize the strip of a medicine, of a tablet or a capsule directly with alcohol. Do not heat them, do not put chemicals over them. They may damage the medicine and you may do more harm to yourself.
Renu Vatswani asks another question. What does a G6PD deficient person do if he contracts the virus, because he's anyways not permitted a lot of drugs?
The only two drugs which are G6PD deficient, only drug which a G6PD deficient person won't be given is HCQS. To tell you the truth, at this point of time, there is no specific proven therapy for COVID infection. Only the anecdotal evidence of use of the drug hydroxychloroquine made us use the drug. So a G6PD deficient person would still maintain the same basic levels of hygiene, maintain the same basic levels of immunity to take care of the infection.
Okay, the last two questions for the day, we have one from Manohar Rampal, and I don't think I've asked a question from him, is I'm 77 years old, male with BP, sugar, angioplasty, but under control with medicine. Sometimes I have dry cough, do a hot water gargle, have 4 glasses of hot water in the morning, do home walking for 5,000 steps, whole day, about 16,000 steps, do yoga in the morning. Sometime there is fear. Your advice, please, Doc.
He's maintaining a rather good health choices actually. He should get himself evaluated for his cough. Understand the reason for his cough. It could be his heart disease which is causing the cough. It could be simple things like acid reflux causing the cough, and he could go back to using that, reading that article on cough which I wrote in December, published in your magazine, which will help him identify the cause of his cough. It may not necessarily be COVID infection, because if it were COVID infection, you would have the disease would have progressed if not taken care of.
Right. One last question, which is once again on precautions. Would you recommend gloves that, it is safer to wash hands with soap and water, since gloves are disposed of, it could be unsafe?
Uh, Wearing gloves is extremely unsafe.
Oh,
So you would rather not use gloves, but wash your hands and sanitize your hands as often as possible. Now, who should be wearing a glove? A glove should be worn by a healthcare worker or somebody who's handling uh, fluids of a person who has a coronavirus infection. Uh, a, a normal human being does not need to wear gloves and go grocery shopping, because with that false sense of protection behind the glove, he's touching all the surfaces around him. It could be the handle of a storefront, it could be anything. He's touching surfaces, and then he's also going to touch other parts of his body, his clothing, his mobile phone with the gloved hand, forgetting that the glove contains, or rather the glove surface has a virus teeming over it.
great, Doc. Thank you for taking all our questions. I'm sure there are several more questions that our readers have, and we'd love to have you once again. Your closing remarks, some kind of advice that you would give to our readers in terms of what kind of care they should be taking, what kind of food they should be having, and as things ease over the next few uh, days in cities like Mumbai, and they have been easing rest of the country. What are the kind of precautions that they should take? Because there's a fair amount of paranoia, there's a fair amount of fear, because it's almost fear of the unknown.
True. So we are opening up, and the lockdown is ending while we are peaking with the number of infections. So every day we are actually achieving a new high with the number of cases. So it is extremely important to understand that when we are going to ease our restrictions, we maintain the social distancing, we maintain good personal hygiene, we maintain good immunity, we maintain good health by exercising correctly, we maintain good health by eating right amount of food, the right type of food, uh, and ensuring safety for self and everybody around you. By doing that, you will prevent infection to self and to everybody in your vicinity, which could be friends, family, neighbors, anybody.
Thank you. Thank you very much, Dr. Agrawal. And thank you very much to our readers and everybody who's been here. Sorry for the slightly late start and the ways of technology. We will be having our Health Live every Thursday. So do look at announcements on our website and on our social handles, and we'll come to you with another round of Health Live at Seniors Today. Thank you very much.